continue with our talk about, dialectical behavioral therapy. And again, dialectical behavioral therapy is 4 parts. One part is about learning skills to tolerate or cope with stress. Another part is mindfulness. You learn to be present through certain activities. Emotion regulation, which we will talk about today, and interpersonal effectiveness, which is how to maintain relationships and set boundaries. Our focus today is about emotions and behaviors. Okay, I'm sure we all know that stronger emotions can cause bigger behavioral reaction. Especially, you can imagine if it is a strong negative emotion, gonna cause big negative behavior. And for example, if you feel angry or depressed or anxious, and the intensity of these emotions are very high, it might lead to, unhealthy food, eating unhealthy food, or undereating or overeating, or drinking alcohol, or using drugs, or another addictive behavior, which we will learn about today, is manipulating others, or cutting yourself, and other self-destructive behaviors. And these behaviors, negative behaviors, can be repeated because it can be rewarded. It causes some sort of reward. We can understand alcohol is rewarding, drugs is rewarding, also food is rewarding. The other stuff we can be rewarding too, and we will talk how it can be rewarded. For example, Teresa is someone who struggled with depressive symptoms, and she has this pattern. When she feels bad, she wants her husband to feel bad too. It sounds like very, negative behavior, but this is how she feels, consciously or unconsciously or subconsciously. This is what she wants. And unfortunately, this behavior is rewarded, and we're going to see how. So again, this is Teresa's experience. When she feels sad or she feels depressed, she pick a fight with her husband. Somehow this causes relief. She doesn't know why. But if you look deeper into the situation, you find when she feels sad and then she pick a fight with her husband recognize how she feels and they give her more attention, more caring, more time, more support. So, and this is rewarding. So subconsciously, her mind learned that when I fight with my husband, I'm gonna get rewarded, or I'm gonna get relief, or I'm gonna get escape from the emotions. So there are more fights in the future because this behavior was rewarded, not directly, but indirectly or subconsciously. So sometimes, we tend to think that our thoughts and emotion and the behavior are logical and reasonable, but most of the time are not. And this is one of the things. Anyway, we're gonna go to our first exercise, which is gonna focus on the negative behaviors that happen because inability to regulate your emotions, especially the negative ones. So as I mentioned, one of them is cutting yourself or self-mutilation. This is a very addictive behavior. I didn't see it a lot in Egypt. I saw it in Egypt, but not to the same degree I see it here in Canada. I'm not sure why it is very common here. But I have seen it in Egypt, but not to the same prevalence. Anyway, why people, when they feel bad, angry, depressed, fearful, any of these negative feelings, they tend to cut. Some people cut themselves because cutting your skin will release natural painkiller, which is endorphins, and endorphins make us feel good. Some people will cut because it is a way of distraction. They distract themselves from the physical pain, from the emotional pain with a physical pain. So it's some way it is a distraction technique. Some people use it as a punishment, especially people who have very low self-esteem and lots of guilt and lack of self-worth. When you feel guilty, this means you deserve punishment. And some people subconsciously use cutting as a punishment. Some people do it for seeking attention. Some people do it to give them a sense of control, because for lots of people, they feel like I don't have a control over my feeling, and I don't have a control over the external world. So what I'm going to do, I'm going to cut myself because I have a control over my body. And I have seen, everything that I mentioned now, I have seen people with discussion that I have seen, they are able to identify one of these reasons for cutting. Anyway, for our exercise today, for all the negative behaviors, we're going to try to answer these questions. Tell me about the cutting and self-mutilating behaviors that you engage in. If there is, like, some people will never do this because they don't feel the need to doing this, or they don't feel that this is something pleasurable, but for others it is addictive, negative addictive behavior. So tell us if you have this experience. Also tell us what is the temporary reward that you get out of cutting yourself, and tell us what is the long-term dangers or cost you experience because of this. Some people had infections, some people get scars, some people get negative memories, like because of doing that. Some people has lots of guilt because of doing this behavior. Okay. Let's can we mute everyone? So for others, another negative addictive behavior is manipulating others. What does it mean, manipulating others? There are people who are addicted to mess with people, which means you force someone to do something that they don't want to do. It gives you a feeling of control or power. And again, people use this as a distraction or gives them some reward. And I'll give you the earlier example we just mentioned about Teresa. She picked up a fight with her husband to subconsciously push him to give her more attention and more interest and more love and more caring. So this is one of the addictive behavior. I have another example here. For this lady, Brandy, she likes to mess with people. So she tell her friends about rumors that she claimed that she heard about from others. So when you tell people some rumors about themselves that you heard from others, it's gonna get people upset. And when people get upset, she pretended to comfort them. So she created this emotional dilemma, and then she tried to fix it, and it's just manipulation and messing with people. It is addictive for some people. Jason, a guy who has a girlfriend, and he's very controlling, and he, like, to the degree he order when they have a dinner together, he makes the order for her, and he doesn't let her spend the time with her friends, and he keep calling her all the time and texting her and ask her to text him back. And with this control, and if she tried to set boundaries or set limits to this behavior, he, threatened her, telling her, I would kill myself if you leave me, or if you don't do what I need, or something like that. So this threatening attitude is a form of manipulation. So again, the same question: if you engage in this manipulative behavior, tell us what it is. What is the temporary reward? What is the longer-term cost and the dangers of this behavior? Okay, so we mentioned the cutting, we mentioned the manipulating behavior. Type of food. Some people, when they get depressed or angry or fearful, they choose certain type of food as not completely healthy because it gives relief and reward. High sugar content, high fat, processed food like ice cream, pastries, all this stuff. And it has it feels good in the moment, but later on you're gonna gain weight. It's gonna affect your self-image. You're gonna feel heavy and slugged. You're gonna feel depressed. So again, tell us what unhealthy food that you eat. What is the temporary reward you get from these kind of foods? Usually high sugar and high fat and processed. And what is the long-term cost and the dangers? Okay, so again, we mentioned the cutting and self-mutilation. We mentioned manipulating others, and we mentioned choosing certain types of food as a negative behavior caused by emotions. Some people will overeat. It's not about the type of food, just the amount. Some people overeat and some people undereat. Okay. And again, overeating, we can understand this one. You're gonna make you emotionally calm and numb your feeling. But also undereating, sometimes it is addictive. We understand the anorexia and bulimia and all these, like there is a self-image problems and the disturbance in the way they see themselves and the ideal weight and this stuff. But also under eating can give you a sense of self-control. If I don't have control over my feeling, I don't have a control over world around me and people and places and things. Okay, I'll try to control something I can, which is by controlling the amount of food that I'm eating. So again, tell me if you are engaging in overeating or undereating. Tell me what it is. What is the temporary reward? What is the long-term cost and the dangers? Again, lots of negative behavior happen with strong emotions, self-harm, manipulating others, choosing unhealthy types of food, overeating and undereating. The last one that is easy to get and easy to understand, the drugs and alcohol. Feel lots of negative feeling, then you cope with the feeling with drugs and alcohol. Tell me if you engage in any of these behavior, alcohol or drug using behaviors, what is the temporary reward? What is the long-term cost? So again, exercise one, like choose one of these behaviors that you feel you engage in most of the time. If there is hundreds of them, if you feel there is a different one that I didn't mention today and you want to talk about it, let us know what would be the negative behavior if it is not related to drugs and alcohol and manipulating others and the types of food, amount of food, and self-cutting. Okay, exercise number 2. I just added this part because I don't want the presentation to sound like, very negative. We want to focus also on the positive. So tell me about something healthy that you want to improve on. Like some people will choose, I can improve my exercise habit by this and this. Like, tell me 2 things that how you're going to improve your exercise habit. Some people tell me, no, I want to work more on my sleep habits. So the exercise is the goal for this exercise is identify healthy habits. Some people will say, oh, I want to improve my exercise. Some people, I want to improve my sleep habit. Some people will tell me, I need to treat my illness or pain. Like some people will have a chronic, we know that with chronic pain come also emotional pain. So if you have a chronic back pain that you need to do something about it, but you are lazy to do anything about it, or you have a chronic neck pain or diabetes or high blood pressure or sleep apnea or any physical problem that you feel it disturb your emotions too, that you need to work on. Again, physical problem cause emotional problems. So as much, I know that sometimes there are some disease that has no cure, but we can, as much as we can, work on coping with them or managing them or treating the symptoms of them. So the last exercise is what Jeff was talking about. Tell us about your experience with online dating. If you tell us about something good or something bad we need to avoid, or a recommendation or suggestion, whatever is your experience. So again, we have 3 exercises today. One of them is tell me about a negative behavior you engage in and what is this behavior, what is the danger of this behavior, and what is the reward you get from this behavior. Exercise 2, tell me about a healthy habit that you need to improve, like exercise, sleep, physical problem management. Number 3 is your experience with online dating. You don't have to answer the 3 questions, just choose 2, and 2 would be enough for sharing. I'm gonna stop now the recording, and I'll give you 5 minutes to think about this exercise. and Brooklyn will run the discussion. Thanks.